A flexible spending account, FSA, is pre-tax money you set aside out of your paycheck to cover medical costs. You can use your Health FSA to pay for medications at the pharmacy, co-payments at the doctor, braces for the kids, chiropractic care, and more. The money you put in your FSA is taken from your pay before federal, state, or Social Security taxes. This decreases your taxable income and increases your take-home pay. So, how does an FSA work? When choosing your benefits, you must decide how much money you want to put in your FSA for the entire year, although there are limits. The amount you choose for the year is taken out of your paycheck in equal amounts and placed in your flexible spending account. The total amount you choose to put in your medical FSA is available on the first day your benefits become active, even though you've only just begun to put money into your account, so you can start using the money immediately to offset medical costs. At the end of the benefits year, you can carry over up to $500 to the next year, but since you will lose any funds over $500, it's important to make a thoughtful estimate of your medical expenses and to understand what you can use your FSA for when you enroll. How do I get my money out of the FSA to pay for these expenses? Most FSA plans offer an FSA debit card, which allows you to pay for approved expenses directly at the place you get care or buy medicine. The card will only work for FSA-eligible expenses and is the most convenient way to use your FSA. If your FSA doesn't offer a debit card, you will pay out of pocket and then send a copy of the receipt to your FSA provider, who will issue a check to pay you back. Can I still have a Health FSA if I have an HSA? With Health FSAs, the rules vary depending upon whether you have a health savings account or HSA. If you don't have an HSA attached to your medical plan, your FSA can be used for prescriptions, co-payments, and other out-of-pocket costs related to medical, dental, and vision care. If you do have an HSA attached to your medical plan, your FSA can only be used for dental, vision, and medical equipment not covered by your medical plan. This is called a limited use FSA. It's important to know if you have an HSA, so you can choose the right amount to contribute to your FSA. To sum it up, a Health FSA is a pre-tax savings account that can be used for out-of-pocket healthcare expenses. You decide at the beginning of the plan year how much to contribute for the next 12 months. Health FSAs are pre-funded on day one with the full amount. Most FSAs offer a debit card, so you can conveniently use the funds in your account. And finally, unused funds over $500 in your Health FSA will expire at the end of the year, so plan accordingly.